So on today's show, we are hoping and we are inviting you to extend that conscientiousness to your health as well. And we are here to try and help you create a more healthy Ramadan this year. So with me to discuss this topic today, I have the wonderful Dr. Zirva Khan, who is a GP. Welcome, Zirva, and thank you so much for coming onto the show. How are you doing?
I'm okay. Thank you very much, Sulthana, for having me, and Ramadan Mubarak to everyone who's watching.
So please do tell us a little bit about yourself for those who may not know you.
So my name is Irva. I'm a GP in the West Midlands. I work for the Royal College of GPs as well, and I also have recently started working with the British Islamic Medical Association. Yeah.
Excellent. So I've already got a list of questions to go through, so we are just going to jump right in and get cracking on, okay? So let's start off on a positive foot. Are there any benefits to fasting that you can think of that our viewers should be aware of?
So, alhamdulillah, there's lots of benefits of fasting, and they vary from spiritual benefits, which we all know and which you've already briefly covered, but also physical benefits, so health benefits. So, provided we kind of carry out fasting how we should, there is evidence that people can improve their blood pressure, they can improve their weight, they can improve their cholesterol, and all of these things overall improve people's health. So alhamdulillah, there are lots of benefits to fasting.
Excellent, brilliant. And so, I mean, as we know, as people get older, they tend to have a few more medical ailments than the younger generation. Do you have any top tips or the approach that someone with a medical condition should take to fasting during this month?
That's a really good question. I think the best way around approaching Ramadan and fasting when you have a health problem is just try to be prepared. Because I think people last minute they panic, especially when they're taking medication and they take several medications in a day. It can be quite overwhelming trying to decide what to do with your medication, how to take it, is it okay to fast and things. So the best advice I can give is just try to be prepared. So, make sure that you have a conversation with your GP or your nurse at the surgery, just to talk about your concerns and make sure that, if you are able to fast, that you can do it safely.
Yeah, so, and I think that is a really good point to make, especially if someone is a newly diagnosed diabetic or has just started taking medication for the first time. They may think their nurse or their GP is actually not going to be able to help them, but they have loads of experience in advising patients on their specific conditions and how to kind of look after themselves during the month of Ramadan. So don't be afraid, do speak to your GP or the practice nurse or the diabetic nurse, etc. during this time. I'm hoping, because Ramadan has already started, that you have already done that. Now, one of the key questions is, what type of food should people eat during Ramadan? Do you have any top tips on that?
So again, a really good question, and I think everyone is thinking about this. This year I feel like people have become a lot more conscious of what they're eating and drinking during Ramadan. I look forward to the typical foods that we eat during Ramadan, but I wouldn't necessarily say they are the healthiest and the most nutritious types of food. So, samosa, kebabs, things that are very kind of, I would avoid eating them most of the year, but I would kind of save them for Ramadan now. Unfortunately, foods that end up being fried, that are high in fat, that are kind of more meaty, more fatty, then they're not very nutritious for our body. And it's really important with our fasts, as long as they are, we're fasting for around 16 hours in the day. We need to be eating and drinking nutritious food and drink. So water-wise, the requirements are the same as usual. So between 8 to 10 glasses of water in a day during the time that you can eat and drink. And then it's really important to eat food that will make you feel full, but also gives your body fuel to continue and keep going. So making sure that you get your fruit. Everybody loves fruit salad when they break their fast. So, having lots of nice watery fruits, having, your date as you break your fast. And then, focusing more on kind of having a balanced plate, really. So having some vegetables in there as well, having some, grilled meat or something with, protein that's been grilled and not necessarily fried. In saying that, I think the odd day where you do fry things and eat them, that's okay as well.
Yeah.
But overall, it's just about trying to get that balance. So I think those things are really important to make sure that we're well nourished.
Yeah, yeah. So I'm just going to dissect a little bit what you've said there, because you've made some really good points. So you talked about the healthy plate, which many people may recall that if you go online, you will find what a healthy plate looks like. So it is recommended that you have a starchy, complex carbohydrate, ideally whole grain, because they are slow release, they are metabolized, sorry, I can't speak today, slowly, and they last longer. Protein, like Dr. Zirva said, also lasts longer and will keep you fuller for longer as well. And there is also fiber, which your body takes longer to break down. So again, will help you keep fuller for longer and not be as hungry. And I mean, the water content can be quite difficult. And I know that they recommend maybe drinking a glass of water before you actually start eating. And then that way you won't overindulge either. And kind of steadying your intake of water from iftar to sahri time will also help, because if you have big quantities in one sitting, it might just flush straight through. So actually to sip them slowly is better for you. What about salty foods or sweets? Any word of advice on those?
So we know salty food, sweet food, beyond the recommended daily allowance, increases our risk of problems like blood pressure and diabetes. And particularly when we are fasting, if we are having a lot of salty food and a lot of sweet food, we might actually ironically increase that risk to ourselves more. But also you will find that if you do eat a lot of salty food, you will feel kind of more thirsty,
Yeah.
but not necessarily in a sense that's comfortable. So you might feel like you need to drink a lot of water after you've eaten your salty food and actually feel very full when you haven't had the content of food or drink that you need, if that makes sense. It sounds a bit confusing, but it's just trying to get the balance, really. So having some salty food and some sweet food is fine, as long as your health allows that and your health conditions do as well. But everything is in moderation. Alhamdulillah, I mean, Islam is a religion of moderation. So, eating as a balanced diet, so, balanced salt, balanced sugar, balanced fruit, veg, etc., is definitely the way forward.
Yeah, brilliant. So I think the key point there was that actually by eating the wrong foods, you can set yourself up for a really difficult Ramadan, because you'll either be not as full as you thought you were, or you'll be really thirsty throughout the day due to the high sugar or salt content. So that's a really good point to make. So we are going to go to a break very shortly. When you come back, we have lots of frequently asked questions that we get as GPs and health professionals during Ramadan. So do come back for that. Now, if you have any specific questions that you would like to ask, you can WhatsApp us on the mobile number that is at the bottom of the screen. You can also call the landline. It is a Wakefield number. Please be aware that standard network rates do apply. Another word of note is that this is just medical education and information. Please do speak to your GP for specific medical advice. We will see you back after this break. Assalamu alaikum everyone, and welcome back after that short break. My name is Sulthana Ahmed, and I have with me Dr. Zirva Khan, and we are discussing how to approach this Ramadan, trying to make sure that it's a bit more healthy than the ones gone by. So Dr. Zirva, just to get straight back to the questions, because we do have a list of them to get through. Now, due to the change in diet, maybe change in the amount of exercise level, obviously the change in times, people complain of constipation. Any word of advice on how that can be prevented or managed if it does occur?
A really good question and a really common problem. I think most people will experience some change in their bowel habit during the course of when they start fasting. So it's very normal that your bowel habits change. So it might be that you don't go to the toilet at the same time that you normally would. But ways to make sure that you are opening your bowels properly and comfortably would be just to make sure around the time that you are eating and drinking that, like you said, we've already mentioned, and making sure that you have a balanced diet, but particularly when it comes to constipation, we need to be making sure we're drinking the amount of fluids that we should be. So, up to 10 glasses in a day. Making sure that we are having our fruit and vegetables because they're very good for helping our bowels move, but also having fiber in our food. So like Dr. Sulthana mentioned before, where we would want to have some bread or some chapatis or some rice, try to have whole meal, and that will definitely help with your digestive system. But if despite those things you find that you are struggling, it might be that you need to see your pharmacist or speak to your GP just to get some more advice.
And another really common problem that patients experience is also indigestion, and sometimes it can be quite severe. I remember when I used to work in A&E, we would get quite a lot of them few hours after iftar complaining of quite intense, tummy pain or even kind of burning chest pain. So any word of advice to help our viewers avoid indigestion?
Again, a really good question. So indigestion, like you mentioned, is really common, and part of it is just down to our habits and the kind of our eating habits change around the time of Ramadan. So we eat a lot at suhoor, we eat a lot at iftar, and actually our stomach is only designed to deal with so much food. And because in Ramadan our stomach becomes a little bit smaller, it's not really able to handle as much food. So the best advice I can really give is eat smaller portions, but maybe eat them kind of a bit spread out rather than all in one go, because you will most definitely feel some kind of heartburn or indigestion, and it might even make some people feel sick. So it's a really easy thing to avoid. But equally, if you are making sure that you're eating and drinking all the kind of nutritious things you should be, taking your time. So like you also mentioned before, Dr. Sulthana, maybe drink some water before you do eat and just kind of pace yourself rather than overindulging. And inshallah, that should prevent any significant indigestion.
Now, the next question that I have on my list is about pregnancy. So people are wanting to know whether it's safe to fast whilst pregnant.
So a good question. I think strictly speaking, Islamically, there's no obligation for women who are pregnant or breastfeeding to be fasting. But I know people have their own personal preferences and they want to fast, which is a choice, and it's entirely up to them. So what I would suggest is if you are pregnant and wanting to fast, please discuss it with your GP, your obstetrician or your midwife, because it might be that you've got a particular reason in your pregnancy why you can't fast. If you do decide to fast, then like we've mentioned with the advice before, make sure that you are having nutritious foods around the time that you can eat and drink, you're having all the right fluid intake. And if there are any concerns with the pregnancy, that you do seek advice. Generally, our advice from kind of an Islamic point of view and also from a medical point of view is there is no obligation. So, don't feel obliged that you do have to fast. But again, it's a personal choice. So I can't make that decision for anyone.
Yeah, so, and the key thing that you said there is that it's not an obligation for them. They are actually able to make it up when they are no longer pregnant. I'm just tagging on to that, the topic about breastfeeding, because I actually was having a discussion with someone just before I came on about women who breastfeed are also exempt from fasting. Some sisters obviously still do try and keep their fast whilst they're breastfeeding, and they notice a reduction in the amount of milk production. Now, this isn't specifically a medical issue, but it is one question that we do get a lot in kind of GP land or to health visitors, etc. And the main piece of advice I would give for that is if you are exclusively breastfeeding and you want to keep your fast, then hydration, like Dr. Zirva said, is key. If you're not able to keep up with the hydration and rest appropriately, on the subsequent day, you will notice that your breast milk flow is reduced. Now, there's no kind of like typical way to go about this. You can see how you go with, you can fast one day, not the next day, and do it on alternate days like that. So it is about trial and error and seeing what works for you. Okay, so moving on. So in patients who have chronic medical conditions, one of the key questions we have is around taking tablets. Especially for patients who are diabetic, it's a bit of a problem because they usually take tablets, you know, in the morning, afternoon or evening with food, or patients who are on, for example, medications that have to be taken on an empty stomach. Is there any generic advice you can give for patients in those situations?
It's very tricky trying to get the balance with tablets because, like you said, you know, unless you take tablets once a day, it's very easy to say, okay, I'll take that with my iftar, with my suhoor. I think it's really important to, like we've mentioned before, be planned. So if it is that you are on medication and you are worried, and I know Ramadan has started, but it's not too late to ask for advice. So, for example, if you are on medication for diabetes, generally speaking, those medications need to be taken when you are having a meal because that's how they work. So whether that means that you change your twice-a-day regime so that you take, you know, your tablets at sahur and then you take at iftar. If it is that you are on medication more than twice a day, then you will need to speak to your doctor specifically about that because they might need to change the treatment regime for the time that you are fasting. But again, like we've mentioned before, in Islam, you know, many of these health conditions where you need to take medication, you are exempt from fasting. And actually, you know, there is reward in following the rules of Islam. So again, it's a personal choice, but there is definitely no obligation. But if you do want to fast, just make sure you liaise with your GP. The other medical condition that sometimes people get concerned about is something like thyroid problems, where they have to take their medication on an empty stomach, or any other medical problems where they need to take it on an empty stomach. So the advice there usually is, so for example, if you take it twice a day, you would need to take it about half an hour before you eat. So on an empty stomach, when you break your fast, you would probably take your tablets as the first thing, and then you would eat about half an hour later, which is really challenging for patients because often they want to do the opposite. So they say, okay, I want to break my fast, eat my food, have my tablets 3 or 4 hours earlier. But what we know about that is that the tablets aren't as effective. So if you want to try and get the best control of your health problem and, you know, fast as well, then those are the kind of general bits of advice I can give. But like I've said before, it's more important that you get that specific advice from your doctor.
Yeah, and I know from speaking to many different people over time, they also say when it comes to taking a tablet on an empty stomach, some people, when they wake up for sahur, they'll have it by their bedside, take it straight away, and by the time they kind of get their sahur food, etc., ready, it's been about 20 minutes, half an hour, and then they can eat. So that's one option. And then just to add to what you've said, sometimes in some situations, especially with a thyroxine dose, your doctor may increase your dose slightly. But again, I wouldn't recommend you doing that off your own back. Do speak to your medical provider before you make that decision. Okay, now this year with COVID looming, and I know BEMA have done lots of campaigning around this as well, we have kind of new questions about can I fast if I have COVID? What's the advice on that this year?
So just like any other illness, if you are well in yourself and, you know, you've unfortunately got coronavirus, but actually you've been affected very mildly, then you probably can fast. However, if you are unwell, just like the advice would be for any other sort of infection, we would say while you feel unwell, don't fast. You can always make up for it afterwards. So, again, there's no obligation to fast when you are unwell. So that would be the advice that's circulating at the moment.
And then just tagging on to that as well, many patients are wondering whether taking the lateral flow tests will break their fast because it involves a swab of the back of the throat and nasal airways. Is there an official advice on that as well?
So, alhamdulillah, the advice is very straightforward for that. So, if you are needing to get tests done, which most of the population will be doing these kind of twice weekly lateral flow tests, they don't break your fast. None of us do lateral flow tests for pleasure, and that's ultimately the reason why we break our fast. So we need to do it, but it doesn't break your fast.
Yeah, brilliant. Now we are going to wrap up now, and with just a word of advice on COVID and mixing and keeping social distances, what would you recommend to people?
So Ramadan is, we didn't really have a Ramadan last year where we were able to see, people at the mosque, see our family and things like that. Now the restrictions are easing. It's very tempting to go and spend time with your friends, with your family. And it's really important that we do still follow the government guidelines, because, they are there for a reason. Alhamdulillah, the cases have gone down significantly, as have the deaths, but that's no guarantee for the future. So if you are planning to go to the mosque, please adhere to the social distancing protocols. Make sure that you are wearing a face mask, that you are keeping your distance, that you are still washing your hands and sanitizing your hands. So these things are really, really important to still keep up with. And inshallah, we can all see a healthy Ramadan safely to Eid.
Yeah, brilliant. Thank you so much for that, Dr. Zirva Khan. We have actually run out of time now. This is the end of the show. I really hope that you have found the discussion with Dr. Zirva and myself useful. Please do tune in next week for another episode of The Health Show with myself, Dr. Ahmed. Take care, everyone.